Hello, I'm Dr. Tom Rogers. I'm a family doctor of 28 years. I now practice integrative medicine where I focus on hormone replacement, weight loss, and some aesthetic procedures. My practice is called Performance Medicine. I have 4 locations in Knoxville and the Tri-Cities area. I was trained at the University of Tennessee, and I've been doing family practice for approximately 28 years. I became frustrated with the way we practice medicine about 7 years ago with not only the insurance companies but also the way we looked at patients. We're trained very well to diagnose disease. What we're not trained well at is telling you why you have this certain disease in the first place and how to prevent it. So I decided to go ahead and do a fellowship in this area. I do a lot of male and female hormone replacement. I'm 58 years old myself and very familiar with low T and how to treat it. A lot of things I do are complex, and it's not just a matter of putting somebody on testosterone, or if you're a female, estrogens. You have to know what you're doing. It's complicated, and that's my specialty now. I think it's safer to use bioidentical hormones than to not use anything. It helps everything. It's not just for your libido or your muscles or hot flashes. It's really for your whole aging being. It helps your bones, it helps your brain, it helps overcome insulin resistance, it helps you lose weight, and you feel better. There's no need for Prozac and some of the other medications when you balance your hormones. I'm huge on weight loss. I think that our #1 problem in this country is obesity. It's supplanted smoking as the #1 health risk in our country, and it's complex also. There's a lot of factors for why people are obese. It's not calories in, calories out. It's very complex. You have a lot of issues that are hormonal, genetic, although that's usually only about 20% of it. You have stress. There's 2 things that's going to cause most of your problems: food and stress. So if you can get to the bottom of those, what they're eating, how much stress they have in their lives, how much sleep they're getting, you have to really get to know a patient. That's why I think the family doctor is really in the best position to incorporate integrative medicine into his practice. I wrote a book that I give to my patients called Total Health, and it covers a lot of topics. It's easy to read, and patients tend to love it. There's a lot better ways for treating stress than just taking a Prozac or a Xanax. Over time, those medications can cause more problems than they can help. Now, I do use them occasionally, but I try to make it short term, and I try to transition them into a less stressful lifestyle, and that may include exercise is probably the best thing, eating the right foods. Sugars and glutens and dairy are very inflammatory, and they just start a cascade of mediators that really make it hard for you to de-stress. So I do a lot of testing that's advanced, and I'm able to detect things a little bit earlier and to hopefully get them on a pathway where they'll be healthy and stay that way. I have an anti-aging type practice, so what I first try to do is get that patient hormonally balanced and nutritionally sound and exercising. A lot of people that see me are, they're in the 40 to 70 range, and a lot of them would like a cosmetic procedure that's not invasive. So over the years, I've probably done thousands of procedures as far as cosmetic fillers and Botox or Dysport. I do a lot of spider vein work. I find that people, when they start feeling good, they want to look better. And there's a lot of good tips and a lot of minor things we can do to make them look 10 or 20 years younger. If you'd like to learn more about my practice, go to performancemedicine.net. All our contact information is there.